Consulting, is here tonight to talk about an issue that I think every family is struggling with, is how do you balance in this intensive, unprecedented times, the learning needs of your child or children with disabilities, along with the other family and health and work needs that your family is dealing with. She's somebody who's spent a lot of time working with kids with disabilities and has been very immersed in how to deal with these issues intensely these past months. I just want to go over a few logistics. At the bottom of the screen, you'll see the chat box, and if you have any questions or comments, please add them there. And then we're joined tonight from my office by Melinda Macht-Greenberg, who is our communications manager, and she'll be pausing at different points to read the questions. And Joanne Pino is from back here, also helping with all the logistics. This is going to be recorded. There's a polling question for you now. And we'll end at 8:45, and Melinda's been generously offered to stay till 9 if we have questions that we haven't answered. Also, just to let you know, we are not going to have a chat next week, the week of July, and our next chat will be 2 weeks from tonight. We'll probably be talking about the state guidance around schools opening in the fall. And from the rest of the summer, we'll be going every other week, every other Thursday night. So there's a poll asking you what kind of disability does your child have. Lily and Joanne, is there anything I missed?
No, I think that's it.
So I'm thrilled to turn this over to Melinda.
Well, thank you. Thank you so much for having me. It's really wonderful to be here, and to share a little bit about what I've learned in working and talking with parents for the last few months. I really would love for this to be an interactive experience. I would love for you all to ask questions, to share your concerns, to share your insights. So please put your questions into the chat box, and so that we can really have this as a discussion and not just as a, not just hearing me talk. So that's my hope. So please write in your questions. I can actually see from this poll, which is really interesting to see, that about, looks like close to 80% of the people who have joined have kids on the autism spectrum. Questions like this, it just occurs to me, maybe a little bit challenging too, because sometimes kids have more than one thing. So my guess is that there's some overlap here. Autism is one of my favorite things to talk about, in addition to the other work that I do in supporting kids and families with special needs. As part of my work at Tufts, I'm conducting a long-term research project looking at autism in special education. And so it's something that we started about a year ago, and it's near and dear to my heart to talk about what kinds of services kids need and should be getting, or not, and are not necessarily getting in order to be successful in school. So I'm glad to see that there are so many families with kids on the spectrum. If we want to start with the first slide, we can jump in. There we go. Okay. So I thought it'd be good to just take a moment and just figure out and just talk about where we've come so far. It seems like we've been in this COVID state for years and decades, but it's only been a few months. March 10th was the last time I attended a school meeting in person. And I remember that I went in, it was actually 2 school meetings. One was at Milestones and one was at New England Academy. And at both of them, I remember that I was wiping down my seat already with disinfecting wipes and waiting to see what was going to be happening. By the end of that week, where I teach at Tufts, had already decided to shut down for the rest of the semester. And as a teacher and educator, I was given 10 days to be able to put my entire class online, which was something that I had never done before. I had only used Zoom once before in my life. So I very quickly became an expert And it went really well. It went incredibly well, but it took a lot of training, a lot of time, and a lot of effort to be able to have a course that could go so successfully. And it gave me a lot of insight into what teachers were experiencing as they were soon to be told that that school was going to be online for the rest of the year. By April 21st, Governor Baker announced the school closure. By June 8th, we were already opening up, and day camps and childcare were allowed to open beyond essential personnel. I also consult to a day camp, so I have a lot of insight into what's happening, and it gives me a lot to think about as we're thinking about the schools reopening in the fall. I feel like I'll know a lot by August about whether or not how it works to be bringing so many children close together. We have about 250 campers who'll be joining us this year, and another 100 staff. So even though we're outside, it's going to be actually, I think, giving us some interesting insight. And if you're interested in hearing more about that, you can all email me in August, and I'll let you know. I'm keeping my fingers crossed that things go really well. I wrote that as of today, most schools are on summer vacation, and there's uncertainty about next year. But of course, because things keep changing moment to moment, as of today, we already have some insight into what's happening next year. So the thing that I've really learned about this COVID experience is that it can be day to day, the data can change, and everybody is constantly responding to new and different things. So unless we have any questions, we can go on to the next slide. So one of the things in the work that I've been doing, and I've been speaking to a lot of different parent groups, and many of the, there are many issues, there are many more than 10 issues that are the struggles for families, but a lot of the issues that I hear about really kind of coalesce around 10 broad categories. And I can kind of go through them here, but I think that we can really talk about them in more depth, because these challenges are the things that as parents, you are all struggling with every single day, and are the things that parents are worried about most of all for their kids. So the first one is, and these are no particular order or priority at all, just as they came to my mind. So one of the big issues is that kids were just not getting what they needed in special education. One thing that I've heard over and over again from parents is that by having their kids at home, they were able to get that bird's eye view and see a lot about what was happening in their kids' education that they didn't know was happening. Parents would go to IEP meetings, or they would get progress reports, and they would think that something was being implemented in a particular way. And that what this process has actually done is really exposed a lot of the weak links in services that children had been getting even prior to COVID. During COVID and the COVID closures, that we've seen just a huge increase in the difficulties and the lack of services that kids are receiving. The remote learning plans for many parents felt insufficient. And at the same time, I think many parents felt that they didn't necessarily have recourse. The remote learning plans, as you all know, did not need to be signed or signed off on by parents. And parents often felt that there were not ways to get kids more of the services that they needed. Even if things were done differently remotely, they were just still not getting enough. And I think in general, there was a feeling that kids didn't receive enough direct instruction. And that was really one of the big sticking points, that many schools relied much more heavily on pre-recorded videos, prepared lessons. Many districts actually had single coordinators for a grade or a school who were preparing all of the lessons. So it wasn't even necessarily your child's teacher or special ed team that were involved in providing the instruction. And kids and parents have been totally overwhelmed, receiving email after email with information about an assignment that was supposed to be done, or some kind of meeting or check-in that they were supposed to have. It never really felt coordinated to many families. And I think many parents felt the burden of needing to really become the teachers for their children, because many of the kids were struggling to be able to access and understand what it was they were even supposed to do when they would be told, open this Google Doc, read all of this, answer these questions, do this project. The kids just needed much more explanation, direct instruction that parents couldn't necessarily provide. And that created, I think, a huge burden on families, you know, in this period. So I'll just pause for a second. I don't know if there have been any questions, but I can certainly keep going. But if there are any questions, I'm happy to answer.
We just have one question. If people have questions, please submit those in the chat box. I'm also going to launch our next poll quickly. So you mentioned a camp, I think, that you're involved with. Someone asked which camp you said you were opening.
Oh, it's Everwood Day Camp in Sharon, Massachusetts.
Is it for kids with disabilities or all kids, or just?
It's a general camp. Although I will say that we have a lot of kids that have a lot of special needs, just by the nature of the population of children. We have a lot of kids on the spectrum or have significant ADHD and learning disabilities, but it's not specifically geared for kids with special needs.
Thank you. I think that's all our questions for now. Please respond to that poll, and I'll keep that open for a little while longer.
All right. So actually, can you just go back to the last slide for 1 sec? Sorry. Nope. There we go. So just to kind of quickly look at the other couple of things here. I think one of the big issues that it was that parents felt that there were very low expectations for kids from March through June. Many, if not all, schools were pass-fail, and the kids didn't necessarily have expectations for the type of work or level of work that they might need to do. And I think as this poll indicates, there are many, if not most of you, who really are saying the same kinds of things that I'm hearing from parents all over the state, which is that kids have either lost skills or certainly have not gained the necessary skills. In fact, I saw that some research that's already been done is showing that as much as 40% less educational learning has been achieved this year compared to in any other year. So that means that kids only got about 60% of the year's worth of education, even through the remote learning time. I think the other issue is that as parents tried to reach out to schools to try and get more for their kids, many schools were not responsive. And I think that this became an enormous issue and another huge burden for families. Schools were often saying that they would that they were meeting the DESE guidelines or that they were providing FAPE, and parents would turn around and say, you know, well, wait a minute now. I don't expect you to do everything, but you know, for example, I have one family that I worked with, and their child was supposed to be receiving reading support 5 times a week, so every single day. And in the entire time from March until June, they did not receive reading instruction even once, not at all. And when the parents tried to ask the school for some individualized reading support, they were told that the pre-printed assignments were sufficient. And I think as many parents, you know, can understand, these are parents of a child that has significant dyslexia, and the parents argued their child doesn't have the reading skills to be able to read these Google Docs or these assignments. And so how are they possibly supposed to be able to do these things independently? And the school was not providing appropriate accommodations or the necessary reading instruction. So they're going to be going back to school next year at a significant loss, a loss of learning. And I think this is the kind of story that I was hearing over and over again. I think at the same time, we had a situation where teachers were feeling like they were doing as much as they possibly could. And so you have teachers who were feeling that they were working overtime trying to create these interesting and creative lessons, but they were totally overwhelmed and completely untrained and unprepared for remote learning. So in fact, they were spending a lot of time creating these very, cute and clever Google Docs, but they were not necessarily able to provide that direct instruction that kids actually needed. And I heard some teachers who said that they also felt frustration around that and that they were told that they could not do more. And others were feeling like they were doing everything they could and they just needed more help. So you have a situation where parents were feeling overwhelmed, teachers were feeling overwhelmed, and kids are just caught in the middle not getting what they needed. So now we can go to the next slide. I think one of the other important issues that also emerged this spring is that schools were not engaging in testing. And because of that, kids were not being evaluated, which led to delays in either IEP eligibility or delays in getting updated services. What I was surprised to see in my work of going to schools with going to school meetings with families and supporting kids with special needs was how many schools said, even though the DESE guidelines were really clear that all the timelines had to be met and 3 years evaluations were supposed to progress. And we were supposed to use the data that was available. And you couldn't delay because schools weren't doing testing. Nonetheless, that was exactly what was happening over and over again. So I had some situations where the schools would just refuse to have 3-year reevaluations, even though the guidelines were clear. And other schools where they would say that they would meet and have the 3-year evaluation, but in the end of the meeting would determine that they couldn't make any significant changes until they had a chance to do their own testing. So they kind of had the 3-year reevaluate meetings in name only, but didn't necessarily make some of the changes. And there's a big concern about what's going to be happening with all of this lost time. I'll pause for another second to see if there's.
Sure, we've just had a couple questions come in. And again, I'm gonna post another poll while you're answering these. Our first question is, I'm wondering if you could share some practical tips for the summer and surviving summer.
Absolutely. So I think that that I actually like the word. I don't know if that was the word in the question or that was sort of your word about surviving the summer, because I feel like that's actually what I keep hearing.
That was a quote in the question.
Okay. Because that word surviving, it seems to me to be the thing that I'm hearing over and over again, that everybody feels that they're in survival mode. I think that, and we can actually, so if we can just kind of go through these last couple of things very quickly and then get to the things that might be helpful, but I'll just kind of continue through this very quickly and come back to your question, if that's okay. Just the other important thing I just sort of really want to mention is just this whole issue about lack of access. I feel like that has been an enormous issue, and I think that I was pleased to see that there's at least some good attempts in the guidelines that came out today to try and make sure that kids are going to have more access, both access to devices, which will be helpful. But it's my personal feeling that I think that Wi-Fi should be considered an essential utility like water, and it should be available to everybody, because this idea that we have to, kids are sharing smartphones in order to be able to get a little bit of something from teachers is obviously not going to work. So why don't we go on to the next slide and we can kind of get more to some of the things that might be helpful. So, I think one thing, and I won't go through this too much because I know that I want to be able to answer your question about the tips, but I think that one thing that I think is going to be really important going forward for next year is that I think that we're going to have to form a new relationship between parents and schools and really create a new paradigm. Because I think that what did not happen as much as is going to be needed going forward is really empowering parents who are going to need to be the catalyst and are going to need to be the active participants to create lasting change with the schools. I think that the relationships with individual teachers can be very important, but I think we need more and increased avenues for communication, including all kinds of things, like that schools should have hotlines so that parents or kids can call in at any time if they have questions or give feedback or get information or answers around schoolwork. And I think that it's actually this new paradigm is going to have to come from parents. I don't think that I think the schools are going to operate the way that they're most comfortable. And it's going to be parents asking for and saying that their kids need specific kinds of changes. And I think that will actually help to lead us forward in the coming year, and that hopefully some of these changes will actually be really effective toward and lasting even beyond this whole COVID period. We can go on to the next slide. Thank you. Okay, so in thinking about, you know, I think this summer is going to be a very difficult time because kids are not going to have as much structure. They're not going to be having the structure from even whatever time or schoolwork they would have been having, or whatever services they would have been receiving. And what I keep hearing from parents is that part of what they're looking for is to be able to get some kinds of some sort of structure or academic support for their kids over the summer, because it's just too long for kids to go from March until September without having the ability to work on any of their skill development. So I think that one thing in terms of answering the question about the summer is going to be, as part of the discussion, it sounds like you're going to be having in the future, is a little bit more around the extended school year services, but also asking your school, even if it's not through the ESY program, but asking your school and your teachers to provide some information that or useful things that kids can be doing over the summer, because just because schools are out of session doesn't mean that kids are not growing and developing over these 3 months of the summer. So one thing that I'm seeing that some schools have started to do is actually to have posting of different kinds of assignments or things that kids can be working on. Even that would be able to give the summer some structure. And I think that would really be helpful. Looking ahead to next year, it's clear that we're going to be going through some period of upheaval during the year. The hope is certainly that everything is going to be, everything's going to be certainly opening in September, if at all possible. But given the way that this virus works, it's entirely possible there's going to be some kind of closure, small closure, or rotating services throughout the year. Okay, we can move on to the next slide. Thank you. So I think in terms of helping and sort of thinking about and juggling, a lot of this, unfortunately, is really going to fall again on parents, because there's not as many resources. There are some camps that are open through places like the Y. There are some programs that are trying to open, and what I'm hearing in my day camp world is that more of these camps may actually start to be opening up as they're seeing that the first wave of camps that are going to be opening as of Monday, as they see how effective they are. And some of these camp programs are going to be opened up on a more limited basis. They might be for a week, they might be for August, but you know, so they may not start right away. But I would certainly suggest sort of looking a little bit for programs as they're opening and emerging. and that many things that are considered daycare are working as camps, and camps are considered to be daycare for the summer. So as you're searching and looking for things that are opening, they may actually be calling themselves daycare when they're actually day camps. But I am definitely hearing that there's some excitement that some of these camps that are starting to open next week are paving the way, and that more are going to be opening later on. I can't be sure about that, but that would be a great thing. I think the other thing is that I think that there's going to be less of the screen time than has been during this sort of school year period. And that kids actually may, because they're not going to be on Zoom or Google or things like that doing schoolwork, may have an opportunity to do some things that are more play-based. And I think it's actually, it sort of depends on your child and what their needs are. But a lot of kids can actually really benefit from having some period of unstructured time. But I think it's also important for families that there be some kind of flexible schedule. So through the course of the summer, it will be really helpful to have some kind of a routine that you have, even if it's your summer routine. Kids can become very anxious when there's a lack of predictability and familiarity. And I think that this period for many of the kids that I work with has really been, it's been very challenging in terms of their struggles with their anxiety and struggles with managing changes and changing or having these unpredictable schedules where maybe they've got something on one day and not something on another day. So I would say that if you have an opportunity to create some kind of flexible schedule for your families, then they can be things that are, certainly kids can sleep late and things like that, but where there's playtime that's involved in the day, outdoor time, and whatever recreation activities are possible that might be built around whatever kinds of therapies you're also maybe receiving for your kids, or any kind of skill-based work. But the most important thing for kids is to be able to have predictability and sort of these anchors of normalcy. Kids can be very adaptable and get used to a new kind of schedule. It's when they just don't have anything that gives them an anchor to hold on to. That's when kids will start to become much more anxious. And when they're anxious, you may see it in some of their behaviors that might reflect that. If you actually want to go on to the next.
We've had a few questions come in. Is this a
Oh, sure. Sorry. Yes.
So we actually have a follow-up question to that question about surviving summer. If you have any fun activities to share for summertime and unstructured schedules.
So I think, I mean, that's a difficult question to answer because it has so much to do with the developmental stage of your child and what some of their interests are, or what some of their special needs might be. So it's hard to kind of answer that question broadly. I think that a lot of it is going to be knowing your child, thinking about things that they would find both comforting and somewhat interesting. But it's so varied, it's really hard to answer that question. Some kids are really interested in coding and computer-based activities. Some are more artistic and would be happy doing all kinds of artistic activities. Some are more musically driven. So it's hard to answer that as just sort of specific activities. My sense is that in the Boston area, there are going to be a lot of things that are going to be available outside that might have been indoor activities. And a lot of this is just, as I'm kind of seeing things, is actually just being announced in the next week or so. So I can't answer that specifically in terms of activities, but.
Melinda, when you and I were speaking, you also had some really creative ideas about how parents could reach out to other parents and plan virtual activities. I thought you want to share some of those ideas? I thought those were might be helpful.
Yeah, I think in this sort of goes for the school year and would certainly apply to the summer too, which is that what kids have been missing is the social aspect of education, of play, of after school activities. I had one little girl who said to me that all the fun parts of school were gone and all that was left was homework. And I think that's because learning takes place in social environments, and kids really thrive on being able to be with other children and with their teachers. And what most kids are telling me is that what they're missing is being with their friends. Another little girl who said, the first thing I'm going to do is go up and give my friends a hug, which is probably not part of the guidelines that came out today, but I think there are going to be a lot of kids where that's going to be their first impulse. One thing though that can be really helpful is for parents to come together, and if it's during the school year, for the teacher to do this by kind of assigning projects, is having kids do something together and having kind of one parent be the overseer or the supervisor of the activity. And that can be virtual, or in this day and age, that can even be some outdoor activities, providing you following all the safety guidelines. But if you have, through virtual activities, have one parent who's kind of supervising the activity and other kids who are engaged in the activity together, and then it gives the other parents of the group a bit of a break, or an opportunity to do all of the many other things that are on your list, from taking care of family members to going grocery shopping and all of that. I think the other thing though that can be really helpful and might be really an interesting thing for kids is for kids to also be part of the seeing themselves as part of their community, both their in-house community and their community out in the world. And being part of their in-house community can be that kids can have different chores and household activities and participate in cooking and things like that, so that they can really, which is both an activity that kids can do, but also gives a chance for kids to be participating and contributing. And I think the same thing for outside of the community. I've seen kids who have been trying to come up with ideas with their friends for different kinds of ways to raise money for other organizations or for other groups of people. And it might be, I had some kids that I was working with, and they were drawing different pictures and then were kind of posting and asking for donations for their artwork, and giving it to a local organization. So I think that kids need a sense of purpose the same way that adults do. And these activities can both be fun, can be structured, kids can do them together virtually. And it gives kids a sense that they're actually making a contribution, which gives everybody that sense of self-esteem that can also be really helpful.
Thank you. I want to make sure we get this next question because we've had several people asking and commenting about transition services. And I'll put a poll up again after I get this out. But this person says, I'm concerned about those students in transition years, ages 18 to 22, who often have their goals built around community-based services for life skills and or internships. If a parent is working from home full-time and there's no one there to work with the child, how do you address these types of benchmarks and objectives? And many of these students are immune compromised or have medical needs, and choosing to send them into those environments in order to not lose services is scary.
Absolutely. I think that it's very scary to think about sending kids into community environments that wouldn't be safe for them or healthy for them. I think that this is also going to be one of those questions that where there just isn't enough information about what can be done just yet. There are some different kinds of therapeutic groups who are trying to provide some services that could be done virtually. But I don't think that there's been as much of the creative options as maybe in some other things.
I think, I think it's one of the things that we have seen that is unfortunately really true is things are very uneven, district to district, school to school. We did have, Lily, I don't know if you're able to add this now, but we did have a speaker present about specifically about the transition needs and remote instruction. And she had a lot of creative ideas of how to access different kinds of learning opportunities. I mean, it's like what the commissioner said in his guidance for reopening schools in the fall. It's never going to be the same quality and outcomes as being able to be in the community, but we can, I don't know if you can put the link.
Yeah, I can, I'll drop that link in the chat.
So we'll share that. And there are, there's a grant program, and I don't know if the families asking this are in a school district where the school districts can participate in what's called the Massachusetts Concurrent Enrollment Initiative. But if your school district isn't, there's still time for them to reach out to some of the state colleges and universities who are including youth with more significant disabilities, 18 to 22, on the college site. But since March, all the state colleges have been closed and been working remotely. And we just got data from the Department of Higher Ed that showed that 85% of the students who had been on the job campus, auditing courses, involved in the life of the campus, with the school district and college working in partnership, 85% of those students have been fully participating remotely with their ed coaches and their classes, finishing their classes, and I think it was like 75% were participating in remote social activities on the college campus. So there are some options, and I think just what we've learned from that shows that things can be done creatively, but as Melinda was saying, it's so often going to be on the families to try to create those kinds of options. But again, call our helpline if you have a transition age youth, and we can and send you some of the resources and ideas we have. One other piece I thought of, again, it's very uneven, but school districts, once they get the PPE and the other, Melinda, you might want to talk about that polling result when I'm done here. Some school districts, after they have things in place for safety, can start providing in-person services for high-need kids over the summer. And the State Department, the question was asked, and this won't help for the families who don't feel it's safe for their kids to go, their adult and older kids to go in the community. But the state was thinking that if there's a way, same thing as with on school sites, if there's a way to deal with the safety issues, that there may be a way to, the way people can do grocery shopping safely and do other things now safely as things are opening up, that it may be appropriate for school districts to start providing community-based transition services. They still have to meet the safety guidelines. So there will be there was some guidance from the state about schools reopening in the fall generally today that we can talk about later on, and there will be much more detailed guidance coming out in the next few weeks. But I think there may be some ways for those families who think it's safe, hopefully if the numbers continue to be down in Massachusetts, to have some community-based instruction within the safety guidelines that are going to be required.
Similar questions, you might have addressed this, but someone asked if you have any idea if extensions or compensations are going to be done for transition age students for the upcoming year. They added there's so much that's not being supplied in terms of functional academics, while some community programs can't be accessed and programs can't be transitioned into slowly if students have medical needs that are keeping them out of school.
The state is hoping to come out with its guidance about compensatory services, how to make up for the lost services and the lost progress that children have made during COVID. Their guidance about how school districts should be making individualized decisions about what degree and what type of compensatory services kids are entitled to should be coming out the week after July 4th. And so as soon as that guidance comes out, we will have more information about what the process will be. I know for the youth, young adults who've turned 22 over these months, that the state's had some, has shared some of their thinking, although none of it is in place yet. And they're certainly aware of the need to prioritize the needs of and the decisions about students who have turned 22. So I'm hoping we're going to get some good guidance from the state, but in 2 weeks we'll know more. And we'll share that with you in a chat as soon as we have the information. So the biggest worries, that difficulties about the child re-entering school with all the changes.
Right.
Can you speak to some of your suggestions and strategies about how to deal with all the transitions and uncertainty?
Yeah, I think, you know, it's interesting to see. I mean, I'm not surprised at these poll results, that health and safety, as well as and difficulty re-entering school, kind of go hand in hand in many ways. I think I've been talking with a lot of schools about actually spending some time to really think about how to help kids with the transition. That I think it's going to be a mistake if schools just open up and assume that everybody's going to come back, and it's as if we didn't have all of this time, and that as if we're not still living under pandemic conditions. So I'm advising schools that I work with to really focus on spending time talking a lot with kids, working on those social and emotional kinds of concerns. What we know is that anxious kids will be more anxious in an anxiety-producing situation, and this is an anxiety-producing situation. So I think that it's going to take a lot of preparation to help kids to be able to transition successfully. And I think a lot of that can't come until kids are actually back in school, because younger kids in particular, it can just, and many kids in general can have a hard time anticipating. And when kids anticipate, they tend to anticipate the anxiety because when things are unknown, kids fill in the gaps with their imagination, and their imaginations can be very active. And so it leads to a lot of worry because they can imagine all kinds of scary things happening. Well, if I go to school, what happens if I get sick? Or if I go to school, what happens if things close again and I don't have, I can't go back? Because of course kids were not given any notice or preparation when schools closed. So I think it's going to be very helpful for parents to try and do some preparing and conversations with kids, but also that schools, because kids are so experiential, that once kids are actually back in the building, that schools are spending a lot of time actually trying to help kids to build some of those coping strategies and to give kids really accurate and useful information, so that kids can feel the reassurance that they're safe and that they will be healthy, and that there are people that they can talk with within the building as well as at home and in the community. But that schools need to offer safe places so that kids can have a chance to talk about what they've been experiencing. I also think it'd be helpful for schools to do activities, to read stories and to do different kinds of things so that kids will have a chance to be able to have a transition period. I'm concerned that if we just get back into September and teachers just start assessing and figuring out where kids are skills-wise, and they may be good at doing that when it comes to reading and writing and other things, but if they don't assess the mental health of the kids in their rooms, that's going to play out later on, because the anxiety and the worry and the fearfulness will play out in other kinds of ways. So that's sort of a broad answer to address that polling question.
Thank you. So it is 8:45. I'm just gonna launch our final poll with an evaluation if people could answer that. And Melinda has graciously offered to stay on until 9 o'clock to answer additional questions. I know we have some more that came in, and we also have some more of the presentation to go as well. So I'm going to launch that final poll. If anyone needs to leave, please fill that out before you go. And thank you for coming, and we will continue until 9 for those of you who can stay. Great.
So Melinda, do you want to, for those who can stay, finish up, and then we can have some more, ask the rest of the questions?
Yeah, so I think, you know, just in looking at some of the things on this slide that can be helpful in helping kids to manage, one of the things that can help is to do what we call shrink the pond, which is really to sort of oversimplify and limit and shrink the number of goals that you may have for the day or for your child's day. I feel like in this COVID period, it's been impossible to work at the same rate and level. And everybody feels like they can't get as much done. Parents are multitasking in so many ways that it can be better for mental health to be able to focus on one or two things that you're going to accomplish each day, and to really be able to feel success in being able to do those things, rather than feeling that sense of, oh, I didn't get to everything. It's very easy for parents to feel guilty. And I keep talking to the parents that I work with and saying, you know, we just have to put guilt in quarantine. There's just not time or space to feel guilt on top of everything else. And it's very easy to feel we're so worried about our kids. We're so responsible for our kids. It's very easy to feel like we're not doing enough. And it is really important to recognize that everybody is really able to do a lot more than they think. And to recognize and feel that success is really important. I think another thing is that I talk a lot with the families I work with is about this idea that behavior in kids is communication. And it's up to us as adults to be able to decipher the code and figure out what it is kids are trying to communicate to us. And when kids are falling apart, there may be a reason for that. And trying to figure that out can be really important, because a lot of times what kids are telling us and what kids have been sharing is that they're taking in a lot of the world right now. They're hearing things, they're reading things, their kids are sponges and they pick up on the emotion around them. There's a lot of worry about health, about economics, about school and schoolwork. And we might see that in kids' behavior. Kids might have difficulty sleeping, or they might have more tantrums, or they might have different kinds of food or eating related issues. All of those things can be a form of communication telling us that kids are overwhelmed. And when that happens, then it's important to really reach out. You know your child the best, you're experts at your own children, but there are a lot of us who are available to help with the individual needs for kids. One of the things I talked about from the very beginning of all of this is that this COVID pandemic is new, but as psychologists, helping individual families with their kids and helping families go through tough times, that as psychologists, we've been doing that for years. And that's something, we have a lot of tools to be able to support families during these difficult times. So what I would say is to encourage families to reach out, to ask for help, and in that way to be able to make sure their kids are getting what they need. Can't remember if there's another slide. Oh, there we go. Okay, we got to the end.
Great, thank you, Melinda. I think there's some more questions. Thank you for staying in Florida. And I just want to remind people, also Lilia put a bunch of the resources into the chat. We did launch a couple weeks ago a new app that you can use on your phone and your computer to keep track of what the school district, if you are getting any kind of ESY services, what the school district offered and how your child is doing. It's going to be really important, especially for the determination of compensatory services, to have as much of a record as you can about how your child is doing. And even if your child isn't getting summer services, if you're concerned about how your child is doing now because of what's been happening for the last 3 months, you can still use that app to document how your child is doing. If you want to make sure that there's some special ways to meet his or her needs when school's open. So check out the app. We're hoping it's going to be very user-friendly and make it easier to keep track of things.
Thank you. And yes, we do have several more questions, so we'll try to get through all of those. Our first question is also related to older youth. We have a child who is 18. Do you have any suggestions for apps with strategies to help him when he gets upset and calming down? And someone in the chat mentioned the Calm app. So I'm not sure if you have experience with that.
There's one that I recommend a lot. I think it's called Headspace. I can picture it, but I can't quite. I think it's called Headspace, and it has a lot of relaxation techniques that can be helpful. Depends, your child is older. For kids that are younger, try and anything that can actually help them to kind of pause and do deep breathing can be really useful. It's actually, there's neurobiological reasons why actually taking deep breaths can be very calming and very soothing. I think sometimes the challenge is that it's very hard for people to use those skills in the moment. And so we really, as psychologists, encourage people to practice doing deep breathing and relaxation techniques when you're already feeling calm, because once it's a more practiced and familiar and well-used skill, it's easier to try and use those skills when you're anxious or having a hard time in the moment. For younger kids, I do this thing where deep breathing technique where I have kids pretend that they're blowing up an enormous piece of bubble gum into a huge bubble. And I have them, as they take a deep breath in and then exhale, that they can imagine and envision that they're blowing this huge piece of bubble gum, and they can watch it get bigger and bigger and bigger. And it can help kids to have this, both a visual to go along with the deep breathing, but it also helps them to have this idea that can sometimes be humorous, and depending on how on the child, then sometimes we'll figure out different kinds of places that they can pop their bubble gum, like, you know, in their brother's room or something like that. So there are different kinds of things that can be really useful. But the key is practicing when you're in a calm state so you can use it when you're agitated.
Thank you. And it looks like someone's sharing some more resources in the chat box as well. So if people are interested, I would encourage you to check that out. Our next question is, teachers all through the state had their unions get MOUs and MOAs to require they work less. Parents are working hard and kids are working hard, but the teachers were frustrated and convinced districts that they should work less. The question is, should teachers be considered essential workers?
That's a hard question for me to answer from a psychological perspective. I think that what most people have found that I've talked with is that, in fact, teachers are essential. Whether or not they're ever considered to be in that essential worker umbrella, I don't know. But I think that people have really come to see the need for teachers, and in a very different kind of way, and that it's that direct instruction that they were missing. It wasn't the fact that they weren't working hard and getting these online assignments going, but they were really missing that actual live communication with the teacher, and felt that that was essential in its own way.
Yeah, I think, you know, many teachers are working really hard, and I think, like Melinda said, are very frustrated too about how, despite how hard they work, they're dealing within the constraints of what the district, you know, what they're allowed to do and what they're able to do effectively remotely. So I think, you know, it's hard for everybody, and teachers are also dealing with the health implications of COVID. They have kids at home. I mean, I think everybody is, for the most part, working hard and very stressed. And it's an interesting question. You know, there are like early intervention workers are deemed essential workers, but they were not providing, for the most part, in-person services either over the last 3 months or so, because things, even essential workers still have to have the ability to do what they're doing safely.
Mhm.
So, but I do think people really realize how important and essential educators are in a new way after these last months, like Melinda said.
And I will say that in the work that I do of going to meetings with families and participating in all these Zoom IEP and eligibility and 3 reeval meetings in these last few months, I actually had much more success with individual teachers than in trying to get a system to change or an entire team to change. So we had one teacher who decided after one of our conversations, she would just leave her personal meeting room on Zoom open all day long. And anytime that kids needed, they could pop in or pop out, and she would answer their questions or teach them something that was confusing to them. I had others who volunteered and said that they would have more one-on-one time with particular kids. So that was not universal, it was not consistent across every district, but there were individual teachers that if I could kind of tap into that, we actually could get some things done. So always think it comes down to the people themselves and sometimes less the organizations.
Okay.
We only have 2 minutes left, right, Lilia?
Yeah, so I can ask one more question. And again, if we're not able to get to your question tonight, I'll drop the helpline number in the chat box again. The last question is, Google Classroom is being loaded with so much and it's not a user-friendly format, especially for students with learning disabilities or intellectual disabilities. It seems like more than the school would ever do in a normal year. Are you hearing anything about remote learning getting better? The school is trying to reduce overwhelming nature of content as well as the screen time impact. So are you hearing anything about remote learning getting better?
Can I, maybe because we have 1 minute, it's okay if I jump in and try to summarize the new guidance that came out, Melinda?
Mhm.
The state issued its guidance. We dropped the long document that's generally about all kids. There's a short description about some of the issues for kids with disabilities, and they will be issuing much more detailed guidance soon. But basically what they're telling school districts is they have to be doing everything they can to be prepared to open for as many kids as possible, hopefully all kids in the fall. The biggest change in the guidance is that because of the new data information around safety guidelines, that the class, they'll be able to have more kids in a classroom because they're going to require 3 feet rather than 6 feet of distancing. For me, that was one of the biggest changes in the guidance that came out. They're definitely recommending that but they're basically saying 3 things. School districts have to be ready to fully open in the fall. They have to be ready for having part-time opening and part-time remote instruction. And they have to be ready for the fact that we may need to go back into a system where it's full-time remote. And what they're saying is that over the summer, to answer the questions, every school district and every school should be developing a plan for all 3 of those scenarios, so that if remote instruction is going to continue part-time or full-time, they will have had better time to figure out how to do things in a way that is going to work better for kids and be the right balance. So I think everybody recognizes that everybody was inventing it as they went, and that the hope is over the summer there will be more time for planning and more training for teachers and speech therapists and others about how to do remote instruction more effectively, because everybody's been reinventing the wheel. It's been largely on the shoulders, as Melinda's been talking about, of families, and we have a little bit of breathing room to try to be more prepared for the fall. So thank you so much, Melinda. I think you've really addressed some very important issues. Families are absolutely have the lion's share of the burden on their shoulders, and these are great strategies of how to try to, it's going to be more of a marathon than any of us realized until we're through this pandemic. So thank you so much. Do you have any closing words before we end?
No, I'll just say thank you for having me. It was great to be able to talk with people. And I think as you're saying, this is going to go on for a while. Next year is going to be, it's going to be rocky. I think people are, there's some thinking that it could be optimistic to think that 3 feet apart, as you were talking about, is actually a safe distance. I think there's going to probably be some discussion about that. And I think that there's going to be a lot of challenges next year, but I think that the big difference is that we are going to be prepared. If this isn't just going to happen like it did in March, and hopefully people are going to spend the summer wisely. The professionals are going to spend the summer wisely, teachers and providers, so that we're really ready for anything next year.
Yeah. Great. Well, thank you all for being here tonight, and thank you mostly to Melinda for your time tonight. And
thank you.
Have a good 2 weeks. We'll see you 2 weeks from tonight.
Thank you. We also wanted to let everyone know that there will not be a chat next week. Julia, did you want to say something about that?
I just said that.
Oh, okay. Oh, sorry. I was typing that into the chat box. I must have missed that.
Yes, have a good 4th on whatever it looks like without the fireworks and the Charles, and we'll see you in 2 weeks. Thanks so much. Good night.
Thank you, everybody.
Good night,
Bye.
everyone.